I decided I wanted to become a nurse in 11th grade. Somebody my father knew took me to Pennsylvania Hospital, introduced me to nurses in the profession, and she was kind of my mentor. And the minute I was in the hospital, I knew I wanted to be a nurse.
When I was a kid, my mom had non-Hodgkin's lymphoma. We were constantly at the hospital. I remember really liking the nurses, and I always did well and liked science and people, so I figured it was a good career path for me.
I decided I wanted to be a nurse actually when I was very little. I was about 3, and I was in the hospital, and there was this nurse, and her name was Nurse Mankowski, and she lived down the street from us. And ever since that hospitalization as a kid, I always told my mom, I want to be a nurse.
I was a stay-at-home mom, and I thought, you know what, I think I can do both. And I just loved the hospital environment, the hospital setting, and the machines and the beeping, and it stirred a passion in me. And I went home and I told my husband, I'm going to be a nurse.
Nurses are trained in both the science and the art of caring for others. Our society reveres and honors them. They're a remarkable group of people that everyone depends on. We not only look up to them, we all hold nurses to high standards. They're usually expected by the public and themselves to somehow be immune to the same issues and susceptibilities everyone else has. But they are just as human, just as vulnerable and complex as any group in the community.
When I was in the emergency room, you were constantly running, on the go, had to be on your toes. And I was. I mean, I was a great ER nurse. I know I was. I didn't realize how it was breaking me down.
When you're getting in your car at night, you're still thinking about Mrs. Smith and her kids. You're still thinking about the person in the bed. It's not just like when you turn the ignition, it all goes away. It stays with you around the clock.
It can be wild, it can be crazy, it can be intense, full of drama. It's everything that you see on the TV programs and then some.
Each year in America, nurses in every corner of the healthcare industry face occupational and personal challenges that can have an emotional and physical impact. They deal with patients in sometimes life and death situations. The distraught family members, the pressure of an occupation that leaves no room for error. Outside of work, the home, marriage, and family, physical and mental health, all can add to the stress of a nursing career.
I started drinking as a teenager to fit in. And when I found that when I drank, all of a sudden I went from being an awkward, tall, gawky kid to funny, cute. The boys liked me.
I actually never drank until I was 35. I think my drinking was a combination of personal problems, my marriage falling apart, stress from bills, and, just like the normal things that people have to deal with. But looking back, my job was more stressful than I would ever have admitted.
I was in kind of a bad relationship that I should have left years ago, and that was progressing because he was actually using drugs. And he was going down, and I was letting him take me with him.
Approximately 5 years ago, my brother was killed in a drinking and driving accident. I handled everything with the funeral director. I did it because I was the one that was expected as the caretaker, as the nurse of the family, that she can handle this, she can do this. And I remember thinking to myself that day, this is probably going to be pretty stressful. I should probably call my family doctor and get some type of pill to calm me down because I'm going to need something. And I took them as prescribed. It got to the point where I was extending the prescriptions longer than I needed to. I would ask the doctor for another script, and I would say it would really, really hurt. And it didn't really, really hurt as bad as I thought it did.
Nationally, it's estimated that as many as 15% of nurses are struggling with substance use disorders. Nurses need a place and the right people to help them develop a lifelong recovery from a dependency on drugs or alcohol. A Nurses Lifeline. More than 125,000 people have come to Livengrin Foundation since 1966 to begin a journey back to physical and emotional health at one of the country's first nonprofit addiction treatment centers. Livengrin provides a specific program just for nurses who are challenged by this disease. Nurses Lifeline, the leading treatment program of this kind in the country.
Nurses come with similar backgrounds. They come with similar clinical presentations. Their personalities, their willingness to give and give all day and to not be expecting anything in return is something that is a core of their personality that needs to be respected and addressed, but is also part of what really can pull them into addiction.
Nurses Lifeline is based on the important balance that is so often missing in a nurse's life between an intense dedication to helping people and the need a nurse has to let go of the helping role and seek out his or her own help. The counseling staff knows about that crucial balance. This team includes nurses who are certified therapists. Livengrin's clinical director is a past president of the International Society of Nurses on Addictions and one of America's leading experts on dependency among medical professionals.
Livengrin has always treated nurses. These nurses would sit in group and they would say, I took opiate medication from my patients. And then the other patients in the room, in the group, would say, wait a minute, my grandmother was in your hospital. And it was a tremendously distracting thing for nurses to sit through and tell their story honestly and have the rest of the group pretty much tell them how bad they are. So we decided nurses needed to be in group with nurses. They are all in the same boat. They all handled the same issues, the same problems. They had the same responsibilities.
Livengrin provides a complete continuum of care, from detox and residential rehab to outpatient and aftercare services. They also deal with the corresponding mental health and spiritual issues that so often intersect with dependency. At the Foundation's quiet, wooded campus outside Philadelphia, Livengrin is a safe haven for nurses in rehab with their own living quarters, where they can open up with others who share similar professional and personal challenges. At Livengrin's convenient outpatient centers, a nurse can benefit from further treatment while putting their home and work life back together. Through aftercare, nurses around the country can connect with others to maintain a vital hometown support system that encourages lifelong recovery. Nurses Lifeline also provides a real collaboration with state licensing boards, advocacy, and alternatives to discipline, along with employers and HR offices. A nurse can get help with return to work issues and keeping the license that they were so proud to attain.
There are many nurses who face either losing their license or having sanctions on their license that could impact their career. And what we do is we're kind of a bridge with that to help people hold on to their license, do what's needed to be done for their own physical, emotional, and recovery well-being, as well as their career, which sometimes is a part of their emotional well-being.
With expertise in working with insurance companies and other financial resources, the nonprofit Livengrin keeps high-quality treatment accessible.
Getting treatment is not shameful. Getting treatment is the right thing to do. I wish I would have done it sooner. I wish I would have known my options. I wish I would have known what was out there. There's nothing wrong with admitting you need help, but because we're a nurse, we're the caretakers and we're the ones that provide the help, we need help sometimes too. And there's nothing wrong with asking someone for help.
There is always hope, because there's help. Nurses Lifeline works.
If it wasn't for the nurse group, my healthcare professional group with the nurses, I don't think I would be where I am today, and I'm in a really good place today. And I'm proud of who I am, and I'll talk about it to anybody who wants to know about a group like that, because it really saved my life.
I had gone through a lot because of my addiction. My ex had taken my kids. I went through years of domestic relations, and 3 months ago I was awarded 100% custody of my boys. It means that every night they come home to me. And none of that would have happened if it wasn't for everything I went through. I'm grateful for everything has come back to me bigger, better, more wonderful. I have relationships with my family today. My dad got to see me marry a really wonderful guy. I have an awesome life today.
I can actually say for the first time in a long time that me today is quite boring. There's no excitement, there's no drama. I've never been happier. I'm so thankful that I came here and I did this actually. It showed me that I could have a better life. I have an amazingly adorable little son, that I wouldn't have been possible had I not come here. And everything's just perfectly ordinary.
Peaceful surroundings that help foster healing. Individualized treatment plans that bring about lifelong recovery. Nurses Lifeline at Livengren Foundation offers the key to overcoming and managing a difficult disease and bringing about a life and a career that can again be satisfying and joyful.